Hey Electronic Valley, this is Kaylee and I'm sitting here at MJA Behavioral with the owner and clinician,
Cassandra.
And I am Crystal. I'm the Director of Marketing and also a clinician.
Yeah, so tell me a little bit about where we are, what you do, why this practice exists.
Oh, that's a loaded question. So why are we here? Some years ago, I went out on my own and noticed that there was a pretty significant need for support. I was getting calls left and right. I was working like 50-hour weeks by myself and realized that it was time to bring another clinician. And so I went on Indeed and started to look for clinicians that could fit the vibe that I was looking for, which was really to maintain a family-based practice. MJA comes from the names of my children. It's their first initials and their middle name. So that's how that sort of began. And so we hired our first person, and then that wasn't enough. And then we kept hiring, and here we are. So we've got our 9th floor location in Shelton, Connecticut, and we also have a 6th floor location in the same space. And in December, we just opened our Fairfield location. So that's been pretty exciting for us and for the growth to be able to provide services to our community.
Yeah, it's fantastic. And I have to say, looking out the window, it's an experience up here on the 9th floor of 2 Corporate Drive in Shelton. We're pretty high up. I think this is one of the highest points in Fairfield County. You can see the sound and everything. So it's a great location. You feel comfortable and
Light.
yes, lots of light.
Yeah, you just feel light up here.
Yeah, exactly. You saw a need, and did you go and open straight away when you were practicing by yourself, or was?
We actually were in Enterprise. So we've been in Shelton. That was our flagship space. So we've been with Cinto this entire time, but we opened a little teeny tiny 1,100. It wasn't even 1,100 square feet office, and that's where it all unfolded. So we ended in that location with 5 clinicians, and then we were like, we need more, and we need to serve more clients. And I came here and met with Bob Cinto. And again, the view that we just talked about really sold me, and I said, this is where we can provide really awesome mental health services. And so we signed the lease, and within, I would say, 6 months, we needed more space, and that is when the 6th floor was born. And so we have, on the 6th floor, we have all of our part of our clinicians are on there, but we also offer wellness services and our groups. So we do group offerings down there, and then we do massage, reiki, and acupuncture. We just had an acupuncturist just start with us. She's pretty. Check out G on the website. Cool guy.
Yeah, nice. Are those services that you can get like added onto your therapy, or is it something that anybody can walk in and check out?
So anybody can do any of our wellness services, right? So you don't have to be a client of ours. You don't have to need mental health services, but our philosophy has been to provide a space where you can get everything that you're looking for, a well-rounded wellness journey here with us. So we offer the therapy side, we offer medication management, we offer group support, we offer those wellness services to be able to really provide a well-rounded experience. But yes, you can just come on down if you want to have a massage or acupuncture or Reiki. All of those are really just wonderful additions to whatever services you're already getting.
Okay, great. So I can have a therapist somewhere else and then come here for acupuncture, Reiki.
Absolutely. And we encourage it. A lot of our clinicians I'm a Reiki provider too, so we have background and we're able to help direct you in the right direction and give resources and provide whatever really it is that you need. So we have a really solid team of wellness providers and clinicians here as well.
That's great. And I know we were talking before, you work with children and adults, so it's full family. Do you
Yep.
family groups, individual?
100%. So we take 7 and up ideally, but if somebody is right on the cusp or the clinician that we're thinking would be a good fit for the child is, yes, absolutely. So we really don't have any age gaps per se. We work with all populations, which kind of segues me into a little bit with insurance, because a lot of people or a lot of practices don't take Medicare and Medicaid, and so we do. And we've seen an influx in our elderly population needing more services and needing to be able to use their insurances because they can't afford the out-of-pocket costs that some insurances have them pay. But we see all ages. We offer med management as well. Crystal had mentioned about you can come in if you want for those ancillary services, you can for med management as well. So even if you see a provider for therapy outside of here, as long as we're able to collaborate with the provider, we're able to do med management in-house as well.
Oh, excellent. And talk more about that full service, making it accessible to everyone. whatever insurance you have?
So that's always a tricky one. So we take most major insurances. So we take Medicare, Medicaid, Anthem, Cigna, Aetna, TRICARE, which is more of a military-based insurance. And then there are a slew of variations within some of those pieces. Like United Healthcare is a huge conglomerate of a lot of offering. And then again, we also have people that have really incredibly high deductibles. And so we offer financial assistance to anybody that needs it. So we really don't turn anybody away. That's something that we have really worked very hard to provide a benefit to people that really need the mental health support but don't have access to it. We also have 2 interns in-house, which is another way that we can provide affordable mental health care services to the community. So while they're here learning, they're also able to help people. And I do want to, because this is live and people want to know, it's important for them to know that they hear the word intern and they get turned off by that word. They're like, oh, they're not experienced enough or don't have the education. And that's really a false narrative. Many of these interns come to us with a ton of experience from other programming. They've gotten their bachelor's in psychology or whatever it is, and they work in clinic settings and they work in support service settings, and they're going for their bachelor's to get further education so that they can be licensed to do the work that we all do. So it's important for people to know that interns aren't, that they have the same knowledge and the same experience, so that they don't get so scared about this idea that, oh, an intern's going to service me, but sometimes they're getting better service than a licensed provider. So,
yeah, so you can piggyback on that too. Like they're coming in fresh with the new data and the new information,
Yep.
right? Like they're still in school and they're talking with their peers and their teachers and those things. So they're coming out with the most newest stuff, right? And so sometimes they really are getting a better experience because they've got new data than I just graduated a couple years ago, but still things change so rapidly, right?
Yeah.
So it really is. It's a great opportunity also to have them learn and experience what it's like to do this. And a lot of them have great experience, even if it's not like even from their previous jobs. And just because they're an intern doesn't mean they're also young either. We've had interns who
all
have
age
lived
bands,
lives, like,
all
right?
age bands, yeah.
And so it's really a great opportunity for both the intern and client.
It's so nice too, because when they work for a company that takes them in and provides them with the services and the education, the support that they need, they're able to grow and provide excellent service to their clients. So from everyone I've met here so far, having known you, Cassandra, for a number of years off and on, yeah, I can fully see how a person coming in here is fully accepted and encouraged to grow. So that's wonderful.
Sure. And the interns are supported by staff, right? So we have
They have supervision and they get to do group supervision. So they have a variety of resources that are part of their time here. And we've been very blessed and fortunate that every intern that we actually have taken on, both from Sacred Heart, Fairfield U, now University of Bridgeport, are wanting to stay with us after they've completed their graduation. That makes me very happy, and I hope that continues to be the trend, because you mold them and you grow them, and then they get to go and do their thing for you. So it's pretty cool.
Excellent. The Valley Community Index report is something that happens on a tri-annual basis. It's something that the Naugatuck Valley Health District and Griffin Hospital and a bunch of major nonprofit organizations in the Valley utilize for different certifications and grants and just data to know their community. I was fortunate enough in this past cycle, 2025, to be a part of that. I helped gather the data and things. And what came out of that was a report that was over 125 pages. It's full of information, full of pretty graphics. It's not a super boring read, I promise. And it's very easy to flip through and kind of look and see what information you need. Out of that came 5 major themes. One being community cohesion, which is what I'm trying to get with Electronic Valley. I want people to feel proud to be of and from the Valley and have something to rally around. Some other things were senior housing and childhood and youth, but a couple of them touched on mental health. So it's a major concern here in the Valley from all the information that we've gathered, and it was in the last cycle, and it's still continuing to show up as a major theme this cycle. So having companies like yours here is a fantastic resource, but people have to know about it. So I just want to talk a little bit about your community engagement, if you only see people from the Valley, for example, how people come to you, what's the intake process, and then also making sure that they have the right fit for a clinician and something along those lines.
Okay. So that's a two-part question. I'll have Crystal answer part of that, and I'll take the first part. When we first opened our doors, and this was not beknownst to us, right? We didn't realize that there were really no other mental health group practices in the general area. We've got a couple that are scattered throughout, but there weren't many that saw kids. So we noticed right away that there was a major need within the community for kids and adolescents. And so that is how we began, in the sense of hiring folks, right, that provided those resources, that were well versed in those resources. So that was that important step. So I'm not surprised to hear that mental health is something. And again, I think in general, post-COVID world, we are dealing with a lot of mental health crises, and I don't foresee that changing, unfortunately, anytime soon. And our intake process, we've done something from the beginning that I think is unique to many practices, and that's that we answer the phone. And I know that sounds quite silly, but it is facts. A lot of times, and this is what I was hearing when we first opened the doors, they were like, "Oh my God, thank God you answered the phone." And I was the one that was answering the phone at those times, and we answer within a 24-hour span, whether it's an email communication, a phone call that comes through. And so that in itself builds that connection pretty quickly. Mandy is one of our office managers, and she's been with us relatively from the beginning, and she has done a really great job of building rapport within the people that call in, and she spends time with them. And with the opening of our Fairfield location, we brought Cass on, and she's also does the same thing. The two of them are really great and work really closely together to make that initial phone call not so scary, because it takes a lot of courage to call a mental health practice and say, "I need support," or "my kid needs support," or "my husband or wife," or whatever the scenario is. So they call, and within a phone call, usually within a phone call, an email, sometimes even a text, it just depends on how they've reached out to us, they will walk away with an appointment. It's very rare that a person who calls up doesn't get that appointment within the first phone call. Sometimes it is a little bit of logistics, right? We got to look at 50 different schedules. And so sometimes Mandy's, "I got something for you," or she'll say, "Hey, these are some clinicians that I'm thinking about. Why don't you take a look at our website and take a look at their profiles, and then get back to me when you figured out which person feels like a good fit." And that's when I'll turn it over to her, because she's the one that created and designed the website.
Shout out to Mandy and Cass. They do a wonderful job in the intake process, and we've gotten such great feedback from clients that really enjoy the care that they provide on the calls. And so in our website, it was important to us, even with the 6th floor location and the Fairfield location, that we really showcase that we are, even though we have all these locations, that we are still a one whole practice. So you'll notice that on our website, underneath the team, that we don't have them separated by location, because we want you to find the therapist that feels right for you regardless of the location, because we also offer telehealth services, which is, as long as you're in a safe, quiet, enclosed space, then you can have a therapeutic session. And so really finding the right fit on our website is pretty simple. We have, under every clinician, they have some of their focuses and some of their expertise, shall you say, that they are, or the populations that they're interested in working with. So it's very easy if you're going on there and you're like, "Hey, I'm looking for," or "Hey, I'm struggling with grief," or "Hey, I'm struggling with anxiety," or life transitions, generational trauma, right? You can skim through all of the clinicians and find what you're looking for. And then each of those bios will lead you to that clinician's in-depth bio, so you can learn more about them straight on the website. And even from there, send an email straight to Mandy and say, "Hey, I'm looking to set up an appointment with this specific person." Finding the right clinician is really the most important part of the process, which is really cool. But our website really does allow that ease, because again, you can find exactly what you want to work on or what you're struggling with right there.
Yeah, and I can attest to that. I did take a look at the website.
It's pretty good, right?
It is, yeah. Compass website development.
A lot of hard work.
Yeah, for sure. Excellent. Thank you so much for having me here. I'm so happy to be able to spotlight a local Shelton business, mental health services. It's fantastic to have you here. Thank you so much.
Thank you.
Thank you so much for putting us in this.
Of course, yeah. We'll drop all the useful information down in the description and check them out. And if you have any further questions, reach out to them. You can reach out to me, and we'll see you in the next one.